How do I make sex less painful? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. This is a great question. If you are experiencing pelvic pain when you are trying to be sexually active and be intimate, this can be really, really frustrating. It can be embarrassing, and it can also not only impact you, but also your relationships, your desire and ability to be intimate with a partner. Today, I want to talk about some things that you can try to help yourself with the pain in order to have more fulfilling, more pleasurable sexual experiences. Now, I want to begin by saying this list is by no means exhaustive, but it's things that I want to share with you as a pelvic floor physical therapist. All right, let's get started. I'm going to introduce you here to my vulva puppet. This is just a really beautiful illustration of the vulva. So starting with some massage along the inner thighs, okay, even the labia on either side of the vaginal opening, massaging that, as well as clitoral tissue. So the clitoris is up here along the top part where the labia meet, but most people think that the clitoris is just this bulb here, the clitoral glands. This is a clitoral hood, which actually covers this a little bit until the clitoris is engorged with blood. But actually, you know what? The clitoris is bigger than that. So beyond just the clitoral glands here, you have clitoral legs that come down and they can be felt behind the labia. So this can be all arousal tissue for females. And so starting with some gentle massage, getting the natural juices flowing and building that arousal level can be key for a lot of people. The next thing that I recommend is just trying some breath work. Really take your time. So breathing down into this area and connecting in. So many people are stressed out. They have their to-do list going. They have so many things on their mind that they don't really take the time to kind of prepare. And that can make a big difference when it comes to pain with penetrative intercourse. So doing some breath work and just trying to relax, maybe with the legs open, supported by some pillows in your bed, can be really, really helpful. Doing some gentle release or stretching for the inner thighs, or even down into this area, especially if you have pain with initial penetration, vaginal penetration, then doing some release work down along the entrance to the vagina can make a big difference. So that can be done by using just your fingers along and through here, inserting one finger and very gently stretching this tissue at that entrance to the vagina. You could even try maybe two fingers if you think about the girth of, say, whatever you're inserting. If you're inserting a penis or if you're inserting a sex toy, you're going to want a little girth to that. So checking that with your fingers and stretching that tissue out, spending a little time. Now, if you're doing this by yourself, it may be beneficial, instead of using your fingers, to actually use your thumb just because of that angle. So you can insert the thumb there. There are therapeutic tools like this pelvic wand. I recommend the Intimate Rose products. So that's what we use here at the Healing Spot as recommendations to our patients. But a pelvic wand is just a tool that can be used into this area to help stretch out not only the entrance to the vagina, but also deeper into the pelvic floor muscles, which those muscles need to be able to expand and stretch in order to allow penetrative vaginal intercourse. So my next point is really making sure that you are aroused prior to penetrative intercourse. I recommend arousal level of 7. If 0 is nothing at all, like stay away from me, I am not at all interested in sex, and 10 is like ready to go, climaxing, like you are right there, you want to be aroused at a level 7 before you do any kind of penetration. Another thing that you can try is actually orgasming before penetration. So that relaxes the pelvic floor muscles, and for some women, this can really be a game changer for her to be able to have penetrative intercourse. Using lubricant is another tip that I have for you. So for some women, they don't have enough natural juices, or that's changed after childbirth, or for whatever reason. And there's no shame in that. There's no harm in that. However, if you need lubricant, use it. That can make a big difference. Another tip is to try sexual positions where you, as a female, are a little more in control of the depth and the speed and the angle of entry. So a good position to try to start out with is on top. So you can have those variables under control. Other positions to try would be side lying or even doggy style, rear entry, and let your partner know that you kind of want to be more in control with that. Okay. Another thing to go with that is use pillows, like a wedge pillow. There's a pillow called the Liberator, or even just regular, pillows to help support behind your back or support your knees or your legs in order to get the comfort that you need with whatever position you're trying. Another tip I have for you is trying vaginal dilators. You can see them here. They're a series of dilators that come in different sizes, and they can be inserted vaginally in order to stretch out the vaginal opening, as well as help to release those muscles into the vaginal area. So if I use my little vulva puppet here again, and you can see how this can be inserted and can actually be angled into those deeper pelvic floor muscles as well. I have done a separate ed talk specifically on the vaginal dilator. So if you haven't checked that out and you want a little more in-depth information, I highly encourage you to watch that video as well. But you can see here are the Intimate Rose brand. That's what we recommend here at the Healing Spot. I'm really a big fan of their products. That segues into the next thing I want to talk about is another therapeutic tool. And this can be used for creating like a buffer for deeper penetration. So I'm using another vaginal dilator here to illustrate this, but this is called the O-Nut. Again, it's a therapeutic tool, and it's a series of silicone rings that can be stacked on top and placed either at the base of the penis or on a sex toy to limit deeper penetration. So you can see here how you can just stack them up. And according to the O-Nut instructions, they recommend starting with 3 rings and then adjusting, either adding or taking them away as needed. Okay, so that gives you an idea there of how that creates a buffer for how deep that is going in. And it should not interfere in any way with pleasure for either her or him. Another tip I have for you is one that for some people it's a little bit harder, I understand, but working on any underlying relationship issues that might be impacting your experience with intimacy and with sex. So with that, I want to say, as a pelvic floor PT, I have encouraged many of my patients to actually talk to their partners and let them know that they're in pain. A lot of women hide this because they're ashamed or they think it's going to impact in some way the relationship. And to be honest, just being honest about the fact that you have pain and letting your partner know that is one of the biggest keys that I want you to consider, okay? That also segues into my next step is, if you need a little help with this, talk to a sex therapist or do couples counseling so that you can work on those underlying relationship issues that may be impacting things. That's beyond the scope of my practice, but I just want to, guide you in that direction. A great at-home resource that I recommend is a book called Come As You Are. It's written by Emily Nagoski, and she is a sex educator. It's all about female sexuality, sensuality. It's a great read. And even starting there will give you a lot of great information that you can put into play and just to get to know your own body and what's normal and all of that good stuff. It's a really, really good read. I recommend it to a lot of my patients and anybody that'll listen to me. My last tip for you is seek out help from a pelvic floor physical therapist. This is what we help women with. I work with a lot of women that have pelvic pain for various reasons, and getting to the root cause of that and helping them to navigate that, whether that be teaching them how to release these pelvic floor muscles, doing some work here in the clinic where I can help them, learning stretches that can be done. I will say some women are told to do Kegels when they have pelvic pain, and for a lot of women that actually makes things worse. So if you've been told that, I give you permission to throw that out the window and seek better help and better advice. One of the things that we also address in pelvic floor PT are like scarring. are any scars that might be into the area. So that could be from an episiotomy, it can be from childbirth. So if you have had a baby and that resonates with you, that is something that a pelvic floor physical therapist can work on as well. And then also addressing any trauma or any injuries that might have happened into the pelvic area, into the hips and the low back, that can really impact this. It can really impact your sexual function and your sexual pleasure. I invite you to head to our website, healingspotpt.com, if you want some more information. We have a page dedicated to pain with sex that may be really informative for you. I encourage you to pick whatever next step works out the best for you, like filling out a form to find out more about our services or to request a discovery session where we would be happy to answer any questions that you have in privacy and get you started on a path to less pain with sex. All right, thanks for watching this Ed Talk.